Good morning. My name is Jill Ratner, and I'm here representing Hands Up for Haiti, an organization which is a nonprofit working in northern Haiti to improve healthcare. Let me tell you a little bit about the organization, about myself. The organization came into existence 6 years ago. During that short period of time, we've been able to do a lot of things, and we do that because we work in collaboration with other organizations on the ground, as well as the Ministry of Health and existing healthcare facilities. We have 4 malnutrition programs. We have 25 in staff on the ground. We run 2 clinics on a full-time basis, even when no volunteers are on the ground. We send about 1 trip a month to Haiti. At least 10 trips go a year. And that provides ongoing support for the clinical work, as well as education, which we consider to be a prime area that we can make a difference in. I'm a pediatrician. I've been in primary care pediatrics for over 30 years. I serve as the chief of pediatrics for the Mount Kisco Medical Group, where I oversee 51 physicians. I have in the past been chief of pediatrics at our local hospital, and I have an associate professor appointment at the Mount Sinai School of Medicine and an affiliation with Mass General Hospital. The organization has a board made up of doctors, nurses, Canadians, Americans, but also includes business people, accountants, people who know about marketing and development, to make the organization quite sustainable. We also have a large advisory board that supports us as well. Our funding comes from a robust donor source, as well as from grants and from the medical trips that we send per year. Let me tell you a little bit about the pitch today. The pitch today is looking at the problem of infant and maternal mortality in Haiti. 56 of 1,000 babies die before the age of 1, and 35 out of 1,000 women die around the area of pregnancy. We think that this is intolerable, and we think the answer is local teaching and improving access to care. We work in 4 locations now with our malnutrition program. We know the leaders in those villages, and we propose to approach those leaders to identify a person that we can train to be a mentor, a leader of a women's support group that will meet once a week around the areas of prenatal care, pregnancy, and healthy baby behaviors. We believe that we can measure our impact by looking at the amount of prenatal visits that take place for the women, by looking at the percentage of women who have a trained birth attendant in neonatal resuscitation present for their delivery, as well as looking at the breastfeeding statistics and the getting babies to a healthcare facility within the first 48 hours of their life. These statistics are spelled out in our proposal, but basically we think we can improve prenatal care to 90%, get a traditional birth attendant who knows helping babies breathe, a course we teach, to 75%, and get 60% of our moms and babies to healthcare facilities in the first 48 hours of life, and to breastfeed exclusively for the first 6 months of life. We feel that this is a simple program that's been demonstrated to be effective. It's not a novel idea. It's been used in Nepal and has been shown to be effective to lower mortality as well as decrease postpartum depression. It's easily scalable. We have other organizations that we work with in southern and western Haiti, as well as in other countries such as Uganda. We feel that this model could be used universally. It's easily scalable. We feel that our 10 trips a year will be able to monitor what's going on in terms of the program, how well the teaching is going, the acceptance by the women to deal with problems of transportation, getting women to their prenatal visits, as well as getting babies to medical care after birth. Our staff on the ground is also in position to really make sure that this program gets administered correctly. We think that we will be able to fine-tune it over time. We expect to find places where we're not succeeding the way we thought we would. We're expecting to find the unexpected and to monitor the program and change it appropriately. Our ask today is to hear your expertise on our idea, get your guidance about novel funding sources, or about traditional grant sources. I really thank you for your time today. I'm looking forward to the conference and presenting more of the idea to you at that time.